Odiogo.com, the web read for you.
Muslim radiographer quit NHS after refusing to adhere to hygiene standards. A Muslim radiographer has tried to whip up sympathy for her resignation from the NHS after she refused to bare her arms as required by official hygiene policy. According to a sob-story article in today's Daily Telegraph, the unnamed Muslim woman claims that she was forced out of her job because she refused to bare her arms as required by NHS hygiene policy. Note the phrasing used by the Daily Telegraph, she was forced out of her job. The reality is that she refused to adhere to the basic demand to ensure that she was clean before working in a hospital. She was told by bosses at the Royal Berkshire Hospital in Reading that all staff must roll up their sleeves to the elbow. But the unnamed woman instead chose to quit, claiming she was forced out by discrimination over her religious beliefs, including the Islamic teaching that women should cover their bodies in public. The NHS's bare below the elbows dress code was introduced in January in a bid to combat superbugs like Clostridium difficile and MRSA, which has increased directly proportionally to the number of third-worlders employed by the NHS. The woman, supplied to the hospital on June 16 by an agency, told the Daily Telegraph she wants to prevent the policy from being universally applied, so other Muslim women do not experience the same trauma. Claire Edmondson, Director of Human Resources at the Royal Berkshire NHS Foundation Trust, said, "Infection control is a major issue for hospitals across the NHS. We have an excellent track record in this area, and to maintain this we have introduced a bare below the elbows policy for all staff or agency employees working within clinical areas." This policy was explained to her when she first started work at the trust. "We are therefore surprised that she has knowingly worked within the policy for 7 weeks and only now has this been raised as an issue." Bizarrely, the Tory-supporting Daily Telegraph has attempted to present this story in a way designed to try and elicit sympathy for the Muslim radiographer, as if she is somehow another victim of institutional racism, which is the code word used by leftists to blame whites for non-white failure in any field. BNP policy on the NHS is very clear. Once a BNP government has saved billions of pounds by stopping the illegal war in Iraq, by halting all foreign aid sent to third world nations who hate us, by halting the utterly bogus asylum racket, by halting the mass immigration invasion, then there will be more than enough money to pay decent living wages to British medical personnel to restaff the NHS. The NHS was created with British taxpayer money, and a truly British government is therefore under an obligation to ensure that it first and foremost employs British origin people. Once this is done, the welter of third world origin diseases and poor performance which currently plagues the NHS will vanish, and the NHS will return to the high standards it maintained before the immigration invasion started.